Did you have a good lunch? Excellent. Thank you, Sarah, for arranging and cooking all night on top of everything else. You may remember that at the AGM, we signed a memorandum of understanding with Chief Day. And you may remember that we also showed a fantastic documentary about our hero, May Cat, and the Ring of Fire. We wanted actually to have May here today with us. Unfortunately or fortunately, she took vacation. And then we wanted to bring a nurse from CINA, the Canadian Indigenous Nurses Association, with whom we have a very strong partnership, and my colleague Linan Mulrooney and Daniel Lau and Josephine were involved in a tremendous webinar with the leaders of CINA to educate really all of us about caring and the challenges and the opportunities with Indigenous people. So this is not a one-off. This will continue with us, and we will continue to work at partnering, opening doors. As I said, and Carol reiterated at the AGM when we signed the agreement with Chief Day, at doing anything and everything we can to ensure that justice, equity, and a better, not just future, but a better today, is reality for our Indigenous brothers and sisters. Because it's just not okay that in a country as rich as Canada, as fortunate as Canada, we have such a tragic, and I would say shameful reality in many of our communities when the rest are having a very different life. And it's not okay that some of the communities still need to have a boiling water alert. And it's not okay that in some of the communities, and I have visited some, and you all have visited some, and we have colleagues like Arik that work with Indigenous people and others, that the trash, which is like in a field 2 minutes, if not one, from their home, is piled up for days and days and days because they come to remove it. Not soon enough. So when we are talking about health, and even when we are talking about illness, in the case of Indigenous communities, is there the in and the out. The in and the out, and it's not a issue of when do we have access to this sector or that sector. And perhaps a better word is not only health, but well-being. So with that, I want to invite you to a panel that will be moderated by Marion Zich, our Director of Communications. Thank you, Marion. And she will introduce the panelists. And what they will share is each one about 5 to 7 minutes of their voices and perspectives on the health opportunities, the health challenges of Indigenous people, and what are the solutions that they propose. And then we will open for questions, so please prepare them. Prepare them because we have the expertise right here to get some of the answers on what aspects we can move forward. So with that, thank you, Marianne.
Good afternoon, everyone. Can everyone hear me? Well, as Doris just outlined, and as you know, as RNAO members, the association has been vocal on this issue. You have been vocal on this issue, not just with respect to access to care, but also the social and environmental determinants of health. We supported the recommendations of the Truth and Reconciliation Commission and called for the implementation of the recommendations in our federal election platform. Doris talked about the letter of agreement between Chief Day that was signed at our annual general meeting last May. Despite our efforts, and despite the efforts of many others who advocate on this issue, in fact, the panel members here are advocates, the names of several Indigenous communities have also come to symbolize great wrongs that must be righted. Grassy Narrows, Attawapiskat, Kasheshewan, they're not just communities, they're news headlines for very unfortunate reasons. And unfortunately, despite the good and intentions of people within those communities, they have come to serve symbolically and in realistic terms examples of our failure to listen and examples of our failure to act. So we've assembled this panel this afternoon, and each of our panelists will share, based on their own work and experiences, and I'll get into that a little bit more, on those insights, the broader insights of health and inequity. So to my immediate left and to your right, Saul Mamakwa is originally from Kingfisher Lake First Nation. He's a health advisor with the Anishinaabe Nation. He also serves on several boards, including the Sioux Lookout Menoyawin Health Center, the Sioux Lookout First Nations Health Authority, the Sioux Lookout Regional Physicians Services, Inc., and the Northern Ontario School of Medicine. He's passionate about getting equitable quality health care for Indigenous peoples, and he makes his home in Sioux Lookout. Welcome, Saul. Lenny Carpenter is a journalist and filmmaker from the James Bay community of Moosonee. He's a member of the Attawapiskat First Nation. Lenny worked for more than 6 years with Wawate News, serving first as a reporter and then as an editor and publisher, covering communities in Northern Ontario. He also worked at CBC Thunder Bay. Lenny is currently a program manager with Journalists for Human Rights, Canada's leading media development organization. He oversees the Indigenous Reporters Program, which sends journalism trainers to First Nations communities in Northern Ontario to train community members on basic journalism skills and practices. The program provides scholarships and internships to emerging Indigenous journalists and, interestingly enough, workshops to non-Indigenous journalists so that they can learn best practices for reporting on Indigenous communities. He lives in Toronto. And Willow Fiddler, who is a proud Anishinaabe Ojai Cree from the Sandy Lake First Nation. Her career in journalism began when she returned to her home community in 2006. Inspired by the positive experience and love for her community, she became determined to share the stories of Sandy Lake. She studied multimedia in college and then worked as an intern with Shaw Television in Vancouver. That opportunity led her to her current job as a video journalist with the Aboriginal People's Television Network, also known as APTN. Willow is new to television, but has covered community news and stories of the remote north for more than 10 years, using print, web, and photography as her mediums. She lives in Thunder Bay. Thank you, Willow. So I'd like to start our discussion, Saul, with you. In your view, what is the single biggest health issue facing Indigenous communities in Ontario?
I would have to say the jurisdictional ambiguity that exists within the health system. It's really unfortunate sometimes that because we're on reserve, sometimes the services are not accessible, and especially for the remotes. So it's really, when we currently, right now, within Nan territory, we are in a perpetual crisis. We've lost very young girls, 11, 12 years old in the last 8 weeks, and very tragic. And what's really one of the things that's really that has come out to me is that the system that exists is supposed to produce outcomes. Actually, it produces outcomes. And the system that's in place right now is a colonial, based on a colonial system. The system is not broken. It is actually designed, working the way it's designed to. And like I can share some stories later on regarding what I mean by that.
Do you mind expanding on that just for a moment right now? Because I think people might have a sense of that, but might be wondering.
2 weeks ago, I went to visit a gentleman, an older gentleman, that's in Thunder Bay. He's in a hostel or a lodge where people come in to stay for their appointments, and he's there for dialysis. And he doesn't speak any English. His partner, his wife, doesn't speak any English either. So I asked him, I said, do you know what dialysis is? He says, no. And then I asked him how long he's been here. He said, I've been here since the end of November. And the reason why I asked him is there's a policy called non-insured health benefits. And that's the policy where Health Canada provides pays for the transportation, accommodations, and meals for people that have appointments in outside the community or in rural areas. But one of the policies that states there is Health Canada or non-insured health benefits program will not pay anybody past 4 months. So they'll be, and I kind of pictured him that he's going to have to move out of that lodge, find his own place, find his own ride to the dialysis, and I can see it happening, whereby he's going to struggle because he doesn't speak any English. He doesn't have any references to get to rent, and I know he's going to get lonely. And what he's going to do, he's going to forego the treatment, and he's going to go home. He's going to go home and die. I know it happens in our communities. It's normal for people to do that. So when I mean the system is designed exactly working the way it's designed, the colonial system, that's what I'm talking about. And but I believe, with the current work that we're doing, I believe that we can change, and I think that's why we're here. That's why you are here as well. We are about change, and so I just wanted to share that.
Yeah. Lenny, if I could start off by asking you that question, and I know you're coming at this slightly differently being a journalist, but you've also visited communities and have your own lived experience. In your view, what's the single biggest issue?
I think it's many of the health issues in First Nations communities all stem from the lack of proper infrastructure within the communities themselves. I go to a community and one of the first questions I ask is, can I drink the tap water? Before going there, I asked, is there a place even for me to stay? Do they have a hotel? If not, can I stay at the community members? And is it where, if I have to stay at a community members, is there enough space? Will I get some privacy, or am I going to have to share with another person? Excuse me. Or if with energy, the community would have many First Nations communities in Northern Ontario, the remote ones rely on diesel generators that are often at max capacity. So they have funding to build some houses, but the generator doesn't have the capacity for that house to be connected to the electrical grid. So with those challenges, you have situations where children are getting sick because of the water that they're bathed in, and so they get infections and all kinds of things, or even just from maybe drinking the water. They're in crammed houses where it's easy for sicknesses to be passed around, or even in a house that might have mold and infestations. So I think those are sort of at the root of many of the health issues that First Nations communities face. Yeah.
Willow, do you want to give your perspective on that?
I think this is on. Yeah, mine is very similar. The access to health services, and not just health, but all services, I think, across the board, but for health services in particular. I just want to kind of get a sense of how many people here have either been to a remote First Nation community or worked in a remote First Nation community. So that means flying, the only access you have is to fly in, or Winter Road if you're feeling adventurous. Yeah, so the example that I think about, really, because my time spent in Sandy Lake was quite valuable to me, getting a very good perspective of community life, daily community life. One of the things, in terms of access to health services, for example, is maternity services. First Nations communities are very much centered around community, around family. And when you have mothers who are expecting and they're growing their families, they're required to leave weeks at a time in order to deliver. This involves usually by themselves. And that's what Saul mentioned about the systems that we have, the non-insured systems usually only allows mothers to go out by themselves. There may be circumstances or special health considerations where they can have an escort go with them. So what happens when mothers have to leave their families for weeks at a time, and I'm not exaggerating, I mean minimum 2 weeks I think it is, that these women are being sent out because there is no facilities in the communities to safely deliver babies. And what does that do to the family? You have mothers that are leaving their families, their children, their young children, their spouses, their jobs, their full-time jobs, and what effect does that have on the families and on a larger scale the communities? And those gaps are, those are colonial systems at play, and it's quite different than the reality of community and family in places like Sandy Lake, where I'm from.
It's incredible, isn't it, Willow? Because not to simplify it, but I will for a second, just so everyone understands. In the South, you don't go away from your family. You're usually back in your family home fairly soon after giving birth. I was within 48 hours. And or what's happening is that more and more births are happening in people's homes because we've medicalized pregnancy and giving birth. And so it is incredible, right? That people have to leave their family and all that involves in order to welcome another family member in. Saul, I want to go back to something that you had pointed out as probably the maybe overarching issue is the federal-provincial turf war, I guess, that sometimes happen. And I can appreciate that certain provinces are doing this better than others. But this confusion, both in terms of policy and practice when it comes to living up to those responsibilities of providing and being responsible for providing health services, do you have any ideas what the answer might be? Given your work as a health advisor and given all of the work that you've done on various boards, what is the advice that you would like to give and think might be the answer?
What needs to happen is the community needs to be given back the power and the authority to make their decisions. Not only the community, but the community members, like even in their own healthcare and their own health. And what currently happens, when, like say, I mentioned that we're in a crisis within our territory. When a crisis happens, what happens is we meet, and then we provide solutions, and then we have impact, and then it continues on. And when between those discussions, there's side conversations that happen when crisis and meetings happen. Side conversations where outside external agencies will talk. So this is how we should do it. This is how we should help them. And then what happens after the meeting and the solutions is, there's a kind of like a pre-allocation. Well, we'll fund you guys to do this, to help this community. And then what ends up happening is the outside agency gets funded, and it just perpetuates that crisis. And so it's the outside people that are gaining the experience, the experts, without the power and authority coming from the communities. We have to empower the communities. And there's three things that need to happen. One of them is resource allocation. Two is responsibility, and accountability has to be at the community level. If it's on the outside, it won't work. We need to have those three things in the community, and we have to empower the communities that way. So I think we need to change the way we do things. Certainly I know the system that's in place, it's not working for our people. The health system that exists is killing our people, and we need to give back that power and authority to the communities. I know it's a long process, but again, we can change.
Lenny, I want to get your perspective on what it's like to
get the proper treatment.
And where did he travel from?
Moosonee, my hometown of Moosonee.
My gosh.
So he had to go all the way down to Kingston to get the proper health supports that he needed. He received, they provided him with some funds, and it was up to him to find his own accommodations and all that. There weren't proper support systems in place for him while he stayed in Kingston. It had a great strain on his mental health. So when I had to cover a story like that, I didn't cover my friend's situation, but when I think about that issue, I think about him, and it's I know he had great problems with it within his family, and it's painful to see when it's, you know, these issues will, you know, affect your loved ones. That when also just in general, when somebody like my dad had a heart problem, and he had to go, it happened to him too, where he had to stay in Kingston for a period of time, and again there wasn't a lot of support systems in place to help him through that, I guess, transition, if you want to call it that. But yeah, you can't help but be affected by the stories, because more often than not, that affects you as well. And I get asked a question too in general about, as a journalist, you're supposed to be impartial and you can't have a political view, or at least have the appearance of having a political view. But as an Indigenous person in Canada, and seeing how the government and society in general views and treats Indigenous people, how can you not be political and also be affected by all the issues?
Willow, you're nodding. Do you want to jump in?
I mean, you asked if you ever get mad or anything. Frequently, almost all the time. That's my reaction, because it's nothing new. The challenges that First Nations communities face, and we hear the same thing kind of over and over again. And in terms of covering the stories, it's almost, as Lenny says, as a journalist, you're supposed to be impartial and unbiased, but for me, it was the frustration that motivates me to tell those stories, to find out why it's happening, to find out who is accountable. And I think for me, probably that's the biggest thing, is who is accountable, who's responsible, and you have, and then you're faced with jurisdictional issues when governments refuse to take any responsibility and people are dying as a result. It does, it makes me very mad, but that's my inspiration, I think, to cover these from a perspective that may not be in mainstream media.
And I remember discussing with Lenny, and I think you as well, Willow, that there is history in your culture of telling stories, right? Elders and so on, and so in a way you're continuing it for the benefit of not just the community, but the wider and larger community. Mm-hmm. Lenny, I would like you to talk a little bit about the program that you're part of, because I think that's also important. Mm-hmm. Educating people who want to be, Indigenous people who want to be reporters, and then the other facet of that, which is people who aren't, who can understand better the culture and the issues, if you don't mind.
Yeah, sure. So in our program, we're currently it's a 3-year program. We're nearing the end of the second, and we're going to start the 3rd year soon. But essentially, at least for the in-community training, we send a journalism trainer, usually someone who's worked as a journalist or at the very least trained as a journalist, to live in the community for 8 months. We get an MOU with the community, and they set up the accommodations and provide workspace for our trainer. And yeah, it's a very informal training program. We send a trainer, and they live there, and they educate any interested community member on basic journalism skills and practices, with just the idea of empowering them to tell their own story, because often when there's a crisis in the community that needs coverage, often from mainstream media, they're sort of, we use the term, then just parachute them in and then get them out and they leave with no, often little follow-up. So the idea is that instead of having this outsider come in, report, building very little rapport and relationships with the community, coming in to report and then just leaving, and then just leaving it out like that. But the whole idea with this is that the community members themselves can report on themselves and tell their own stories instead of relying on outsiders. Yeah. But we also provide training to non-Indigenous journalists. So in recent weeks, I've been to a few journalism schools like Carleton, Ryerson, Seneca, Humber, and just provide a workshop on best practices when reporting on Indigenous communities, noting some of the historical context when it comes to treaties, the Indian Act, residential schools, and just general tips on how to engage with community members. And a big part of it is terminology. How do you, what do you call First Nations person as Native and all that? That's usually a big part of it. But yeah, just making sure they have the proper context and how important it is actually to have or build relationships and build a rapport with the people that you're covering, because historically media hasn't been kind to First Nations communities, institutions in general, and we often make this comparison during our workshops, is that institutions, when you have the various governments, the churches, when it comes to residential school, they're institutions. Media is also seen as an institution, and I'm trying to keep talking. I was like, I tried to push through it, but I couldn't. Sorry. But yeah, so I try to make these non-Indigenous journalists or journalism students aware that they're viewed as an outsider, as a representative of an institution, and that they really need to build those rapports and relationships. Yeah.
I want to sort of expand on a point you made, because the importance of training people so that they are reporting on their community and know their community, because they're part of the community. Yeah. I used to work at CBC, and so I know a number of the journalists who end up being asked to fly in and cover stories. Attawapiskat is a good example of how as soon as the reporter leaves, the story disappears from the airwaves, it disappears from the news headlines, and the sort of lack of focus and attention then, so it just gets forgotten. And so that's another example of how institutions are not kind, because if it's not in front of you, you just assume it's gone, and yet everyone else in that community is still struggling with those issues. So I want to bring the conversation back to you, Saul, because how, apart from going beyond the issue of the federal-provincial struggles, what are some more immediate steps that can be taken that's part of your work right now to try and improve the situation? There's sort of the long-term goal, and then there's shorter-term goals. Can you talk a little bit about that, your vision, what you're working on that you can perceive will make some headway?
I know, like for immediate needs, like I said, our communities are in perpetual crisis state, almost at the suicide epidemic state, and maybe even reaching its pandemic state. and I know governments respond to us, but all it does is de-escalate the situation. Even though there's incremental change, like reactionary, it's reaction, and it's not. It's incremental change just perpetuates the crisis, and right now today, we're reaching out to get mental health for people, for youth. The crisis, in one of our communities there, in early January, we were sending kids as far as Edmonton, as far as Ottawa, to get the treatment that they require, because children and adolescent services, whether it's developmental or access to mental health services at the community, is minimal at best, and at worst, it's non-existent, and it's really the state that our communities are in. And I know in that particular community, there was, we had to send out at least 50, 60 people out of the community just to make sure that they're safe, and that's the state that we're in. And so immediate, that's the immediate, and then we're just starting to look at the intermediate and the long term, and trying to address those gaps. Stopgap funding is not cutting it anymore. Status quo is not an option anymore. We need to approach it where we have to have a different approach.
Willow, you talked a little bit about using your current profession to tell the stories that you want to be told. That's your positive way of dealing with that. So tell me a little bit about that, because you work for the Aboriginal People's Television Network. So it's not like you're working for a mainstream network where you have to convince people that this story is worthy of covering. Any story relating to Indigenous people would be worth covering. So, but tell me, is there one story that's more important than another? How within your network, who determines what stories are more important? Do they tend to be more based on process? Do they tend to be more based on governance? I'm just trying to get a better understanding of what your editors want, and how that might square with the things that you see that you want to cover.
Mm-hmm. So Aboriginal People's Television Network, so is APTN a mainstream media outlet? Some will say yes, some will say no. I think for me, the challenge I've found is what role does really media play in First Nations communities? And that's something that I've kind of struggled with a little bit. We look at mainstream media as being a tool to hold people accountable. It's a tool to hold our governments accountable, people accountable. But that doesn't really exist. That same concept doesn't really exist for media in First Nations communities. And that's not to say that they don't utilize their own tools for accountability. And it's something I kind of struggle with a bit. But so for like APTN, do we kind of lean more towards mainstream media where we're holding governments, being First Nations communities, the leadership in First Nations communities? Are we using that to hold them accountable? And who is it going to impact, and who is it going to benefit? One of the most important things I learned, I didn't grow up in Sandy Lake, but I returned there for about 4 years, 10 years ago. So one of the things that I learned there was, one of the most important things was just the you know, the foundation of community, I think, is quite different than we see here in the rest of the country. Things are done to benefit the community as a whole. Decisions by leadership in First Nations communities, decisions by families or whoever, is done considering the community's well-being as a whole. Nothing is done for individual gain. You're not going to find, well, you might find it, but I mean, it's you know, people aren't looking out just for themselves. It's a community approach. It's a community model. It's whatever. So how does mainstream media fit into that? That's an ongoing thing. Yeah, sorry, I kind of lost it there.
No, that's. I know there are people in the room who are anxious to ask questions, so I'd like to throw it open to the members to ask questions. There are still microphones around. What happened to all the microphones? Oh, there's a couple. Yep, there I see them too.
Hey, thank you very much for coming. I really appreciate the dialogue and the questions. Forgive my voice, but my name is Arik Rankin, and I'm a nurse practitioner. I have the pleasure of working at Deduata Desne's Aboriginal Health Centre in Brantford, Ontario. I also have the pleasure of working with the Canadian Healthcare Agency, which I'm one of the educators to train and educate nurses that travel into many of the communities that you're from. And in fact, actually, I'll be in Sandy Lake in March, which is a community that I'm very familiar with over the last 12 or 13 years. And also I've had a chance to visit both of your other communities too. Very strong people, and it's reflected today, and it's wonderful to hear your voices. I have a few questions, but I'll stick to one, and then if there's time for more, I'll certainly come up. I know that there's different ways for us to train and educate ourselves through whether it's trauma-informed care or Indigenous cultural sensitivity or safety training. I've also had various teachings about the 7 generations and how we're in the 7th generation now for healing and reconciliation. I'm wondering if you could, either one of you, or if there's time, to provide your perspectives and any suggestions that you have to us as healthcare professionals, how we can improve our practice and honor your culture in the practice that we go throughout as we interact with Indigenous patients and clients throughout our careers. I'm going to suggest that's, you know, and I think that's something that a lot of people want to know. How do you help? How do you become informed? I know that things like cultural sensitivity training, you know, things like that are designed to promote, to build a better understanding of First Nations people and communities. What I want to suggest on top of that, though, is to become more aware